Good day everyone, I am your student nurse Christine from Davao Doctors College, BSN 111J. And for today's video, I am going to perform the assessment of cranial nerves. First, check the doctor's order sheet if available. Next, determine the scope of assessment needed and prepare necessary equipment. Third, perform hand washing to deter the spread of microorganisms. Next, greet the client politely, introduce self and verify client's identity, ask how the client would like to be called during the assessment, establish rapport with the client. Good day, ma'am. I am your student nurse, Christine from Davao Doctors College. May I know your name, please?
I'm Angel Hernandez.
How old are you, ma'am?
I'm 17.
When is your birthday?
March 8, 2004.
Ma'am, what do you want me to call you during this assessment?
January.
Okay. Next, explain the procedure to the client and how he or she can participate during the assessment, provided client the opportunity to clarify, ask, or raise any question. Ma'am, for your information, I will be doing the cranial nerve assessment, and all you have to do is to cooperate and participate well. And also, I have to touch some parts of your body. Is it okay for you, ma'am? Okay, ma'am. Do you have any questions or clarifications before we start?
No.
Okay. Next, ensured client's comfort, privacy, and confidentiality assessment setting was assured to be safe, secured, and free from distractions. Position client to be seated comfortably. Now, as you can see, I already closed the door and the window because it is confidential and it will remain between the two of us. Do you have any questions again, ma'am?
No.
Can you seat yourself in a comfortable way? Okay, thank you. Okay, we will start the assessment. First, cranial nerve 1 or the olfactory. Ask the client to clear the nose to remove any mucus. Then close eyes, occlude one nostril and identify a scented object that you are holding, such as coffee powder or bar soap. Let the patient describe the smell. So, ma'am, can you clear the nose to remove any mucus?
No.
And can you close your eyes, ma'am, and exclude one nostril? What do you smell, ma'am?
Coffee powder.
Okay, thank you, ma'am. And it's right, it is the coffee powder. Next is the cranial nerve 2. To check for visual acuity, use an eye-held card and ask the patient to cover one eye and read aloud the print. Okay, ma'am. Can you cover your one eye? The left one. And please read this one. Hold it.
P1132 S1132 00294.
Okay, thank you, ma'am, for the right eye.
P1132 S1132 00294.
Okay, ma'am, thank you. Next, to check for visual fields, face the patient directly and ask the patient to look into your eyes, then place your hands 2 feet apart laterally to the patient ear. Slowly move the fingers until the patient identify them. Repeat in upper and lower quadrant. Okay, ma'am, for this assessment, I will put my hands here and please do not move your head, only your eyes. Did you see it, ma'am? Did you see it? Okay, thank you. Next, the cranial nerves 3, 4, and 6. The oculomotor, trochlear, and abducens. Check the upper eyelids while the patient is looking directly at you. The eyelids should not obscure the vision. Okay, ma'am, I will check your eyelids. Please don't move your head and focus on me, on my eyes. Next, inspect the pupils. They should be round and equal size. Then check the papillary reaction by shining the pen light in the pupil and observe for the direct consensual. Okay, I will use, ma'am, for your information, I will use the pen light. to shining the pen light in the pupil and observe for the direct consensual reaction. Please, again, don't move your head and focus on the light, the pen light. Okay, thank you, ma'am. Next, hold your fingers about 10 centimeters from the patient eye and, of course, observe pupil dilation while asking the patient to focus on your finger and apply. Just focus on my finger, ma'am. Okay, thank you. Then, lastly, check for extraocular movements in the 6 cardinal direction of gaze. Stand 2 to 3 feet in front of the patient and ask the patient to follow your fingers as you make a wide H in the air. Okay, I'll stand in front of you, ma'am, because I will be making a wide H in the air. Just follow it. Do not move your head, only your eyes. Okay. Next is the cranial nerve 5 or the trigeminal. The mandibular, maxillary, and ophthalmic division should be tested symmetrically for pain. Light touch and temperature for pain as a Q-tip sharp and dull ends. Ask the patient to close the eyes and stimulate the forehead and cheeks at the points indicated. Use both of the Q-tip as you test along scattered areas. Compare symmetrical areas on both side ribs. Okay, ma'am, I will use a dull and sharp thing so that I can put so that you can feel. Just close your eyes now. Did you feel it, ma'am? Okay. Next, to test for light touch using a wisp of cotton, then test in scattered areas and compare sides to check the corneal reflex. Ask the patient to look up and away from you. Approach the patient. Feel it, ma'am. Did you feel it, ma'am? From the side out of his lane of vision and lightly touch the cornea with a fine wisp of cotton as I performed earlier. Repeat it. Okay. Next is the cranial nerve 7 or the facial. Stand in front of the patient and ask to smile, frown, show teeth, puff cheeks out, purse lips, raise eyebrows, and close your eyes tightly against resistance. Normally, the patient could do these maneuvers easily. Ma'am, can you smile for me? Frown, show teeth, puff cheeks out, purse lips, raise eyebrows, and close your eyes. Thank you, ma'am. Next, the cranial nerve 8 or acoustic or vestibulocochlear nerve. To assess for hearing test on ear at a time and include one of the patient ear with your finger. Stand 1 to 2 feet away from your patient and conceal your mouth to prevent lip reading and test the open ear at first by whispering numbers or words that contains equally accented syllables such as 99 or baseball. Ask the client to repeat what you have whispered and repeat on the other. Okay, ma'am. Can you please repeat what I have said? I will cover your right ear, then repeat after me. 99. Baseball. Okay, thank you. Next, to assess lateralization, to use perform Weber's test using a tuning fork and place the base of the vibrating tuning fork on the top of the patient's head. As if the sound is louder in one ear or same in both ears. Perform the Rhine test to compare air and bone conduction. Place a vibrating tuning fork on the mastoid process behind ear when the patient is indicated that the sound is no longer here. Quickly place the vibrating tuning fork near the ear tunnel. Be sure to also check the opposite ear. Next is the cranial nerves, 9 and 10, glossopharyngeal and vagus. Ask the patient to say and assess the patient's voice. Is it a horse? Next is the cranial nerve 9 and 10, the glossopharyngeal and the vagus nerve. Ask the patient to say and assess the patient's voice. Is it a horse or does it have a nasal quality? Observe the post palate and the vulva. The soft palate, parenchyma, and the vulva should remain midline. Inspect the anterior and posterior pillars and the pharynx. Okay, ma'am, can you say for me? Bigger mouth, ma'am. Okay, thank you. Test the gag reflex on one side at a time using a tongue blade and after the warning. Next is the patient stimulate at the back of the throat lightly on each side in turn. You should see a rise in the palate and other signs of gaggings. The patient to swallow, it should be done without difficulty and refrigeration. Okay, ma'am, can you say again? Or just check your mouth. Okay, thank you. Next, the cranial nerve 11 or the accessory nerve. Open the patient's in the gown to reveal the upper trapezius muscle. Ask the patient to shrug his shoulder upward against your head. Hence, evaluate the strength and contraction of the upper trapezius muscles. After, ask the patient to turn his head on each side against your head and observe the contraction of the opposite sternococleidomastoid muscle and notice the force of the muscle against your head. Okay, ma'am, can you shrug your shoulder? Again, ma'am. Next, can you move your head slightly to the left? To the left, ma'am. Next, to the right. Slightly, ma'am. Next is the cranial nerve 12 or the hypoglossal nerve. Ask the patient to open his mouth and assess for tongue and atrophy at the facilitations. After, ask the patient to stick his tongue out. Note for any asymmetry or derivation from midline. The tongue should protrude straight out. Okay, ma'am, can you open your mouth and ipagawas ang hangka? Okay. Okay. Thank you, ma'am. Okay, ma'am, the assessment is already done. Do you have any questions or clarification before we end this assessment?
No.
Okay, if none, ma'am, so thank you for the cooperation.